Joining us now for more on this is Kansas Senator Roger Marshall. So, Senator, you serve on the Senate Budget Committee. You've got a pretty good idea how this works. Assuming it gets to the Senate, do you think Democrats will actually provide the votes needed to get to 60 and get it through?
I think eventually they will. Maybe they'll shut it down for a day or two. Time will tell. But look, this is just the next chapter of Trump derangement syndrome. They want to do everything they can to slow us down, to slow down President Trump's agenda. But remember, they own this budget. This is President Biden's budget. This is something that they should have taken care of last year. So they should be able to support it. They're the ones that wrote this. It continues spending at the same level. Maybe we save a little bit, but that's their big problem. They want to extract a pound of flesh. For their votes, they want more spending, more social programs. We're not willing to give, so we'll see. If this doesn't get through on Friday, if the government shut down, then it's on the back of the Democrats, it's on the back of Chuck Schumer.
And Democrats are saying that this bill hurts Americans. What's your take on that?
Well, I think it helps Americans. I think the number one thing we could do for most people is cut the interest rates and cut inflation. As we're spending less in the federal government, then we'll be printing less money up here. This is the first step in slowing down inflation, which will impact interest rates. So I think that's the big challenge ahead of us right now is inflation, cutting back the cost of gas and groceries. And I think getting towards a balanced budget is a first step in doing that.
Mm-hmm. You know, Senator Hakeem Jeffries, the House Minority Leader, he talks about Medicare, Medicaid, Social Security, veterans, and they're trying to scare people. You've seen this. You're part of this process. Does that House plan put cuts to any of those critical groups?
Of course not. There's actually increased spending. We're spending 50% more today on Medicaid than we were 5 years ago. Medicare will be the same as well. Look, there's lots of waste, fraud, and inefficiencies in Medicare and Medicaid, but this bill doesn't impact any of those. The spending continues the same. I think that is all just a false narrative and a false lie.
I do want to ask you about this. I know last night the Senate voted to advance the Halt Fentanyl Act, so a bill which would punish dealers who sell fentanyl-related substances in the U.S. with a 10-year minimum sentence. Everything I've read about this act would be good for this country and help curb this crisis, yet MSNBC put out a headline just yesterday that reads, passing the Halt Fentanyl Act would be another dark moment for U.S. drug policy. Senator, I just don't follow that headline. Do you think this gets bipartisan support on the Senate floor?
Yeah, I do. I think that it'll continue to advance with bipartisan support. And what this bill does is make fentanyl and its analog a Schedule I drug. That means that no matter what where you find it, it's illegal. And no matter what form it's in, it's illegal as well. So this is going to help the police officers, the sheriffs, the prosecutors, all of them get the prosecution across the finish line. So this is a step in the right direction. Most importantly, President Trump is controlling that border. Record decrease in the number of people illegally crossing this border now, a record drop in the known gotaways as well. So legislation like this empowers our local law enforcement to get this off the street. Again, this is still the number one killer for young adults. The number one killer for pregnant women and women that have had a baby is still fentanyl poisoning and suicide. That's how big of a problem this is.
Yeah, absolutely.
Yeah. Senator, last night the Senate also voted to confirm the Secretary of Labor, Lori Chavez Dreamer. You're a member of the Committee on Health, Education, Labor, and Pensions. Now, I know the Labor Department absolutely critical to the president's America First agenda, growing support from union members, creating more career opportunities for Americans other than just college. What do you think the biggest task facing the new secretary will be?
Yeah, I think you're nailing it so far. Think about this. We have 7 million open jobs across the country right now. 7 million open jobs. And if I told you we had someone come into this country who's going to employ 7 million people, we'd all celebrate. Well, guess what? We have 7 million healthy, working-age adult men that are not working right now. 7 million open jobs, 7 million healthy adult men that aren't working right now. And about a third of those people have a substance abuse or mental health problem. That needs to be addressed. But 2/3 of them don't have the skill set that they need or the desire to get a job right now. So we need to improve this attitude of how important a job is. That'll help people's mental health. But mostly she needs to focus on helping people get the skill set. We can work with unions as well as community colleges and tech colleges for apprenticeships and short-term programs to help equip people for the skill set for the jobs that we have in this country. 7 million open jobs, 7 million healthy adult-age males, not even hardly looking for a job right now. Let's match those up.
Yeah. Senator Roger Marshall, always great having you with us. Thank you for taking the time this morning.